But sometimes the knee and these chains are capable of traveling pains into other areas, correct, Rebecca?
Definitely.
Yeah. Do you want to tell everybody about that then?
Yeah, yeah. So um, it's really interesting that sometimes the cause will feel pain either at the knee, right?
Hmm.
And then, but it's not always necessarily caused right because of that tendon, right? So if
Correct.
I have pain in the front of my knee, right in that front part, a lot of times that's caused more from tension in other areas,
Hmm.
especially a lot of those overuse chronic injuries that we see. I see a lot of that like quad tension, right? Or like trigger points even in your quad or in your, the outside of your hip and everything like that can kind of really affect down the line. And same thing, you may have some referred pain if you have an injury to your tendon, right? It can go the other way. You might have pain either in a different spot in your knee or in different areas. And I'm sure you can elaborate more to that because
Yeah.
you've had a lot of experience with that way.
Absolutely. Well, and I know some people are just listening to this, they're not watching this, but you were not only just pointing up, going like up the thigh toward the hip, but you also kind of did that subconscious pointing
Mm-hmm.
down.
Yep.
So
Travels both
knee
ways.
pain can be tricky. It could radiate back up to the hip. That's why sometimes when people come in, it could actually be a little tough initially to assess, is this actually a more of a hip problem or is it more of a knee problem? Because
Mm-hmm.
if you have that whole chain taken up for pain, you actually got to figure out which one is the problem, and it can radiate its way down to about the ankle as well too. We were talking about this before, but effectively the knee is just a hinge joint. It just bends and it opens, right? It really just kind of has one cardinal plane of movement. So as a result, whenever we have pain in the knee, we're not dismissing your knee pain. You definitely have knee pain, but usually it's just not enough to only treat the knee pain and not work up into the ankle or the hip.
Mm-hmm.
There was an expression that we had in chiropractic school. I know they say similar things in physical therapy circles and whatnot, but the knee is a direct responder to the hip and the ankle, insinuating that yes, that might be the primary source of pain, but you almost assuredly have something secondary that you have to treat at the hip. A lot of times it's insufficient glute firing, and that's what's then making the pounding impact at the knee the most.
Mm-hmm.
But you could get somebody out of knee pain, but then if we don't go back and basically strengthen up the glute, then that person's going to be back in a handful of months anyway because we never address the full problem.
Correct.
Same thing at the ankle, like somebody's got a revved up super tight calf, which thankfully we basically work on the calf when we're working on any sort of knee.
Mm-hmm.
But again, if we don't fix out like that ankle muscular imbalance across the calf versus the tibialis anterior on the front, that person's just going to be back again. So we kind of have to work effectively, have to work with just about everything.